Welcome, everyone. I am Krista Westervelt. I'm Associate Director of Healthy Aging with Partners in Health and Wholeness, which is an initiative of the North Carolina Council of Churches. We're glad that you're here with us today for our Faith Health Connection on Hearing Health is Brain Health with Kathy Dowd, Executive Director of the Audiology Project. Before we get started, we'll just do some quick announcements with you. Would love for you to take a look at our website. We have some upcoming events that would be of interest, including some events around harm reduction in Hickory and Fayetteville, North Carolina. And so we'll pop that link in the chat. And then we have a grant application deadline coming up as well. And so we'll link that in our chat as well. So grateful to have you with us. We'll put that information in the chat. Without further ado, I'd love to introduce our presenter today. We have with us Kathy Dowd, Executive Director of the Audiology Project, and she's here to talk about hearing health and brain health with us. Let me stop sharing my screen. Okay. Thank you for joining us today, Kathy.
Oh, thanks, Krista. Let me get my PowerPoint up and so I can share my screen here. So, but thank you so much for having me. And let me get this set where I can see. So just a little bit of information for me. I've been an audiologist since 1978, a long time, and I retired in 2014. But we've been doing a lot of work since 2011 with the Centers for Disease Control around diabetes and hearing loss, because they were totally unaware of this link. It's been very important, and it's taken us 10 or 11 years to get guidelines about diabetes and hearing loss. So I've worked in school systems, I've worked in ENT offices, I worked in skilled nursing homes for about 21 years. And it's interesting how many people don't understand all the medical issues that are causing hearing loss and even auditory processing problems. You may hear at a certain level, but if you have an auditory processing problem, it's not going to come out clear. So you have to be tested for that. And then they actually can do therapy or treatment for that. So hearing loss is a silent epidemic. It takes about 7 years for someone to get diagnosed and treated. And it's one of the largest unmet medical needs in the United States and probably in the world. Only 20% of the people that have a hearing problem are actually identified and treated. And part of that reason is because it's an invisible handicap. So doctors don't see it, health organizations have not seen it, and they don't even realize there are links between chronic and infectious diseases and hearing loss. So we have a lot of educating to do with our nonprofit. Statistically, 48 million people in the United States have hearing loss. 1 in 5 teenagers, 1 in 3 people over 65, 2 in 3 people over 75 have a hearing loss. Tinnitus, that ringing that you get in your ear sometimes, can be an indicator of a hearing problem. So it's very important if you have ringing that you get your hearing checked. 1 in 6 Florida residents are affected by hearing loss. It can start as early as when you're born. Babies can be exposed to a virus in the womb and incur a hearing loss very early on, or it could be genetic, or it could be trauma from falls or noise exposure, that sort of thing. And it says 16% of physicians screen for hearing loss. I don't even see 16%. My own physician is in a very large group, and his response to me about checking for hearing is that hearing aids are too expensive. So that's a good excuse for him, I guess. But many people just don't seek help. The problem is, if you don't get your hearing checked, you have a higher risk of a cognitive delay and also more of a risk of falls. So it's because your balance system and your hearing system are connected to each other. And a lot of people don't realize that. So it's very important to keep up to date with what your hearing levels are. You are not going to know if you have a hearing problem. So is it age by itself that causes hearing loss? There was a huge national meeting in 2016 about improving access to hearing health care for hearing loss due to aging. And I don't think it's aging per se. I think as we age, there's an increase in the prevalence of chronic diseases. So, for example, my mother-in-law got diagnosed at age 84 with diabetes, very late in life. She already had congestive heart failure and hypothyroidism that caused hearing loss, and she wore hearing aids. But nobody realized when she was diagnosed that that was another trigger for perhaps more hearing loss. Ototoxic medications. Some medications actually will damage your hearing. And I really think that's more what's causing the prevalence of hearing loss. So you just have to be observant and get your hearing checked on a regular basis. This is a huge issue for people with hearing problems. It's called anosognosia. It's the inability to know that you're sick or that you have a sensory impairment. And when I first read this term, I thought, oh my heavens, that's exactly what happened when people would come into my office and I'd ask them about their hearing and they'd say, no, I don't think I have a hearing problem, but my family does. So the person themselves doesn't feel any different. They know they can hear, but they just feel like people mumble. It's not them. So, and it's actually a neurological deficit. This term I read in a book called I'm Not Sick, I Don't Need Help by Xavier Amador. And he encountered this. He was a psychologist. He encountered this when he was in his internship. And he had to go into a lady who had a stroke and could no longer move the right side of her body. So he went in and introduced himself and said, I'm here to help you because I understand, because of your stroke, you can't move the right side of your body. And she said, yes, I can. And he thought, okay, well, raise your right hand off the bed, your right arm off the bed. And nothing happened. So he repeated it. And the lady said, I did. And he said, no, you didn't. She said, you're holding it down. And he said, no, I'm on the other side of the bed. So he said, okay, look at your arm and raise it off the bed. And when she looked at it, she realized she couldn't raise it off the bed. That's anosognosia, the inability to know you have a sensory impairment. So it's not, people don't realize this. What you're going to see for somebody with a hearing loss is that they're going to ask for repetition, or they might bring a third party with them to appointments just to make sure they don't miss anything. It is associated with cognitive decline and depression, as well as social isolation, stress, and confusion. It's very difficult when people are laughing at a group because there was a really great joke somebody told and you have no idea what it was. It's very frustrating. But from a medical management standpoint, it's important for doctors to know, and any medical professional, that when their patients have a hearing problem, they're going to miss the verbal instructions. And they're going to end up being non-compliant with the recommendations for their medical treatment. And the doctor or the medical professional themselves are going to have worse patient outcomes. So it is a domino effect with the consequences of hearing loss. Now, I only approached CDC about diabetes back in 2011. However, there's chronic kidney disease, cardiovascular disease, hypothyroidism, Alzheimer's disease, Paget's disease, and Crohn's disease are some of them. There's even more than that, but these are the main ones. So if you have high blood pressure, you should be getting a regular hearing test. You'll never know when it shifts unless you get it tested. That's the only way to know. And I pulled some North Carolina Medicare, traditional Medicare numbers. There was somebody did a compilation of all the people in North Carolina who had tests for hearing in 2017. So my focus was, okay, what's diabetes? 29.1% of the people had diabetes that got their hearing tested. That is right on the mark with an NHANES study that was done from 1999 to 2004. They found the incidence of diabetes in hearing testing at about 30%. So I have a lot of confidence in these numbers, but look at hypertension, high blood pressure. 65% of those people that came for a hearing test had high blood pressure. Hyperlipidemia, high cholesterol, is 55%. Ischemic heart disease, 33%. Chronic kidney disease. And I didn't even include all the medical diagnoses. I just pulled out the ones that kind of matched what I was trying to relate to people. There's many, many comorbidities with hearing loss, though. So don't think just because you don't have these that you may not have a hearing problem. Again, as you age, you get a cumulative effect of so many things. So what we've learned from an audiology standpoint about diabetes is hearing loss is caused by cochlear microangiopathy. That just means the blood vessels, the small blood vessels in the cochlea, which is the hearing mechanism, are growing and bleeding blood into the cochlea, which usually is just a fluid. You put blood in there, it's going to disrupt the signal. There's also neural degeneration. So the 8th cranial nerve comes off the cochlea and it's losing its sheath, its covering because of diabetes. So it's not going to transmit the signal up to the brain as quickly and as well as it should. In addition, there's a higher risk of balance and falls because, first of all, you lose the feeling in your feet from neuropathy. You also have diabetic retinopathy, and then you also have vestibular effects of diabetes. So all those things are going to increase your risk of falls just from diabetes. When you look at diabetic pain and infection control, some of those medicines can affect your cochlea. The ototoxicity is for your cochlea. The vestibular toxicity are the drugs that affect your balance system, your vestibular system. So you can look these up, though, on rxlist.com. That's one way to look up all your medications to see if there's any possibility that they may contribute to falls or hearing loss. Now, this slide was from Michael Duenas. He was the chief public health officer for the American Optometric Association. So I met with him in 2016, and he was so excited to learn that hearing is also affected because he had given a congressional presentation, and he did mention it. He said, but nobody else seemed to know it. So now it is very much known, at least in the United States. I'm finding internationally that people don't know about this. So we have a lot of work to do internationally. But look at everything in your body is affected by diabetes. I will say, in addition to getting your vision checked and getting your hearing checked, if you have diabetes, make sure your doctor refers you to a diabetes education specialist. Medicare covers, I think, for 6 to 10 visits when you're first diagnosed with diabetes, and they will help you learn what you can eat, how to exercise, how to check your A1C, all those things that are critical for you to know right from the very beginning. And this is another slide from Dr. Franklin out of Johns Hopkins in Baltimore. He's done a lot of work about Alzheimer's and hearing loss. When I saw him present and I saw this slide, I thought, oh my heavens, there's the microvascular disease from diabetes, or it could be from something else. And it does affect your hearing and your auditory processing. Again, you're not going to realize it. You might have your family complaining to you about the fact that you're not listening to them, you're not paying attention, but you just may not have heard them. So one other chronic disease I'm going to cover is cardiovascular disease. Usually with cardiovascular disease, you will get a hearing loss from strokes, a deep vein thrombosis, a pulmonary embolism, and just even high blood pressure. All of those things can cause a hearing loss. Usually if somebody has a stroke, like that lady I was talking about earlier, it affects the hearing only on one side, and the other side might still hear fine. The issue with being able to hear only in one ear is you cannot hear speech in a background of noise with just one ear. So that's the problem. I mean, and working in school systems, I found kids that had hearing loss only in one ear, but the disruption from them being able to hear the teacher, if there was a pencil sharpener or if a lot of rustling of papers, they needed to be up front and very close to the teacher in order to hear well. There's a balance and fall risk, obviously, a fluid buildup in the extremities, a loss of feeling, which is neuropathy. Usually it's hypertension related. And then you've got the medications. So loop inhibiting diuretics, Lasix, furosemide, as well as pain medications can damage your hearing. So if you're on any of those medications, look them up on rxlist.com and see if one of the symptoms could be hearing loss. And if you get any complaints, or just as a routine matter, get your hearing checked. Now this is a Flintstones video, and I'm going to show it just to let you see what it sounds like to have a hearing loss. There will be a hearing test up in the corner. And what I've noticed as an audiologist on the hearing tests that they show, the low-pitched sounds are still very much either in normal or just a very mild hearing loss. It's the mid pitches or the high-pitched sounds that are going down as you watch this video.
1, 2, 3, 4, 5, 6, 7. Aha! You're on my apartment building on Granite Avenue. You owe me $300. Get it up?
Fred, take it easy. It's only a game.
Wilma, I'm just like them big tycoons. I play to win. Now, Barney, pay up or get out of the game. Put the bucket. That's 1 down and 2 to go. Ready? It's your turn.
I don't have any more money either. You got it all.
Then I'll take the mortgage on your open toe.
Well, come on, take the bank, will you? Don't just sit there like a dummy. I will not have you talking that way to our guests. Come on, Barney. I think we'd better go home.
So that's what it sounds like to have a hearing loss, although it's not a complete hearing loss. And it was just mostly in the low frequencies that you could still hear. So I'll stop that there. Again, you don't know what you don't know until you get your hearing checked. So that's the only way to find out. And you should get it checked every year, just so you catch anything that's starting. And you find out if it's something that you're doing or something that you're taking that might be causing it. So in nursing homes, and this is where I'm focused right now, the need for hearing services of audiology are very much in demand because the incidence goes up to 90%. 90% of the residents in nursing homes have a hearing problem. The unfortunate thing right now is many people think that it's a cognitive issue, and they're not even checking hearing first. You also have to monitor hearing because of any of those chronic diseases or illnesses, and because of medication. So depending on the medication, you might need to have your hearing tested every 2 weeks to see if it's changing. And they might have to change the medication if it's dropping rapidly. So once you're affected by medications, 9 times out of 10, the hearing does not come back. So it has to be monitored. Staff in the nursing homes need to be trained on how to refer people that they've noticed are just not responding, or they just do seem to be cognitively impaired. They ask a question and the resident says something totally off the cuff, not at all in response to the question. You know, is that cognitive or is it a hearing problem? There are federal and state laws that require that hearing be assessed within 14 days of admission. So again, it's not happening. And I've been speaking with CMS because they have a hearing assessment, but they developed it in 1987 without any input from audiology, and it's not a valid hearing assessment, unfortunately. But if you can treat hearing, it improves the quality of life and the quality of care for the resident. So audiologists must be part of the assessment team, and especially before any cognitive evaluations are administered. Why say that somebody is cognitively impaired when you have not checked their hearing? It may just be a hearing problem or an auditory processing problem. So some of the things that you will see, again, if you have family members in a long-term care facility, sometimes the prescription rates for mental health will decline when the resident has better hearing. So you don't have as much anxiety or depression due to untreated hearing loss. When I was working in nursing homes, I remember staff coming to me saying that one lady, after she got her hearing aids, she started singing. They didn't realize she had been in the choir at church. And so she would sing to them, where before she hated to even come out of her room. Another issue is unintended weight loss. Because if the CNA comes to the room and says, "You ladies want breakfast," and only one lady responds, the other lady doesn't get breakfast. And I actually saw this in one nursing home where one lady had not been getting breakfast for months, and she was going next door to another lady's room and trying to eat off her tray. So it's really tragic when that happens. Disruptive behaviors. The people themselves that have a hearing problem are very upset if somebody comes in and tries taking off their clothes because they don't realize they're going to give them a shower, and nobody's talking to them, or at least they think that, because they don't hear anything. So what may be disruptive behavior could be an underlying hearing problem. So it's important, again, to test. Again, as I said, the balance organ is connected to the hearing organ by the 8th nerve. So it's very important that anybody who's falling often needs to have a vestibular evaluation and a hearing evaluation. And their socialization is going to improve. They're going to feel more comfortable going to bingo or just going out in the hall and talking to people if they can hear and communicate better. let me see if I can get this. Okay. So symptomatic similarities of cognitive issues. When you look at, hold on a second. When you look at the similarities between Alzheimer's disease and hearing loss, they're almost identical. What you see in Alzheimer's as depression, anxiety, and disorientation could just be a hearing loss that's not been vetted, that's not been treated. Reduced language comprehension mirrors the reduced communication ability. Impaired memory looks like reduced cognitive input. So I fit my grandmother, and this was back in the 80s, and we have a history of Alzheimer's in my family. And everybody was saying, oh, she has Alzheimer's. Well, she came in and she had a significant hearing loss. So I fit her with hearing aids. And she lived in Greensboro, even though I was here in Charlotte, North Carolina. And my mother said the most stark thing that she noticed was that my grandmother quit asking the same question over and over again because she heard the response. So if she wanted to know how Rita was doing and my mother answered, she was able to hear it. She didn't repeat that question again. So what looked like impaired memory, could have been the hearing loss. Down here, denial, defensiveness, distrust, suspicion. I mean, all those things. Get the hearing tested again before you do any cognitive evaluations. It's very important. So speech therapists are usually in the facilities, and they are obligated by their professional guidelines to screen hearing before they do anything or refer. So these come from their professional guidelines. If anybody has advanced age, any chronic health conditions, any disorders of the ear, again, you won't know that until you get tested. Any exposure to ototoxic and vestibulotoxic medicines, any recreational noise. If you go to a basketball game or a concert, get ear protection, because usually the sound is over 90 decibels for a long period of time, and you're going to get noise exposure and a hearing loss from that. You could have genetic factors in your family. You could have head trauma, a history of falls. You could have a speech, language, and cognitive impairment. But again, these are the reasons why the speech therapist must screen hearing and refer before they test for it. It's very important. So, and a history of falls. I have a sister. I just spoke with her last week. She's been falling for the last couple years, actually. And she went and had her hearing tested, unfortunately, at just a big box store. And her right ear was worse than the left ear, which could be that she might have something going on medically with that right ear, but they did not refer her. The next time she went into the doctor was very concerned about some pain she had in the right side of her chest. They did an x-ray. She had 5 broken ribs from those falls and just had never had any of it checked. So I do think her hearing loss and the broken ribs had something to do with each other. You fall and hit your head, you're going to get more of a hearing loss. We have a free hearing screening on our website. If you go to theaudiologyproject.com and you look under impact over there on the right-hand side, it says about impact educational materials. Under impact, you'll see this screening test. You can do it on your phone. You can do it on your computer, on an iPad. Just be in a quiet place when you do it. When you hit the start button, it'll explain what they do, but basically they're going to give you 3 numbers and you just punch those numbers in. And then they go on to another set of 3 different numbers, and they go back and forth between your right ear and left ear. This is a valid hearing screening. The CDC links to this webpage. So if somebody is looking up on the CDC webpage about diabetes and hearing loss, they can actually come and get their hearing screened. If you fail the screening, then obviously you need to have a full evaluation. But ignorance can be bliss. It's just that you're going to pay the price in your medical treatment if you're not listening, being able to hear everything that physicians and medical professionals are telling you. So it's very, very important. So it takes 3 minutes. You can just plug in some earbuds. You don't have to have any calibrated. It's a digits and noise, as I said. It actually was on the World Health Organization website for a long time. So, and it should be something that Medicare uses as an option to find out who has a hearing problem. Although it's only in English, unfortunately. So if you speak French or you speak Spanish, you can't use this as a screening tool. So audiologists, for the most part, are the experts. We do diagnostic testing for hearing and for balance. And then when we find, the doctors have us do the testing so they'll know what the medical or surgical need is. You can't look at a person and see that they have a blockage in their ears, in their hearing system. It only shows up on the hearing test. So we have a degree of either a master's, a doctorate in audiology, or a PhD, and we have certifications. So it's very important, if you want to be correctly identified and evaluated and treated, that you go to an audiologist. The audiology scope of practice, these are all the things that we can do. We evaluate and manage hearing. We can do balance screening and evaluations. We can treat hearing loss and some balance problems. We can counsel for social, job, and personal. We can evaluate for tinnitus, the ringing in your ear, for cochlear implants, and also pediatric specialties, which, you know, is a whole nother ball game of looking at hearing for children. So, but hearing aids do work. Now, unfortunately, my sister's hearing aids that she bought at this big box store are not working because they did not test correctly. She sent me the hearing test, and I realized they did not cover up her good ear when they were testing the bad ear. So the sound crossed over, and that's what they took as the test result. So again, going to an audiologist, you're going to be tested correctly. The selective hearing aids for men, well, that we really don't have that option, but it's kind of cute. So I will tell you, I'll take any questions, but if you or anyone in your family or any friends are in nursing homes, and if you have any questions, since I have worked so long in that place of service, take down my email address. Send me any questions or concerns that you have for your family member or friends or anybody else that might be in a skilled nursing facility. We are working on a program to go out and train, you know, if we get the program approved. So, and this is our website, theaudiologyproject.com. So I'm going to go ahead and stop the share, and if anyone has questions.
Thank you so much, Kathy. I know that we had a few that were in the chat. Someone had asked about the autotoxic meds, and I know you kind of mentioned some of them, so they were interested in that. I did put the link to the RX list in the chat for folks if they wanted to check their medications. Are there other ones that just right offhand that you think are most common in terms of that?
Well, I have another sister that got a hearing loss from hormone replacement treatment.
Oh,
So
wow.
hormone medications, and she got a mild loss. She works at a public health department in South Carolina, cancer chemotherapeutics. And I had breast cancer a couple of years ago, and I went into my surgeon and said, why are you not referring people to get their hearing checked if they're on chemo? And she said, we don't have time for that. I said, well, I just sat out in your waiting room for 45 minutes. And then when I'm back here in the exam room, I've been sitting here 15 minutes waiting for you. We have this online, so it's unfortunate. The chronic diseases, as I said, falls can incur a hearing problem. Medications like Lasix, furosemide, can cause hearing problems. My mother-in-law had an infection in her gut. It was called Clostridium difficile, or C. diff. And she was in Kentucky. I just remember hearing stories that, well, they're working on it, it's not working. And finally I heard they've got her on a medicine they think is going to work. And I thought, great. So I went out to visit with her, and I walked in her room and said something to her, and she said, what? She had her hearing aids on, so I listened to them and they were fine. But I went to her chart and looked, and she was on Lasix for her cardiovascular, that takes the fluid off the extremities. So she was on that, but they had given her gentamicin, which is strongly ototoxic. And you put those two together, what it did, when I was able to come out and bring my equipment to test her hearing only went down slightly, but her ability to understand disappeared. 0. She had 0% discrimination for speech. And that it never came back, which was terrible. I mean, you could see her anxiety increasing over time. There was nothing that could be done for that, unfortunately. Now, there is research that's out that says there's a way you can deliver both of them and not cause as much disruption, but I don't think physicians have seen that. So.
Wow. So maybe in addition to going to that RX list, it might be helpful for folks to check with their pharmacist and see if they're aware of how these drugs interact with one another in that case, or is there a way to kind of see where the cumulative effects might be landing with these types of drugs?
I think pharmacists should be able to look it up. And if you ask them about, is there any danger of a hearing problem with this medication or with any of my medications, they should be able to look it up and see. They might not know it offhand. But yeah, they have great online ability to find all those. So.
Well, it seems like a great reason to especially keep a list of what you're taking regularly, especially if you're getting them filled in different pharmacies, or maybe one physician doesn't know. I mean, it's gotten better with the online, the doctors communicating with the electronic health records, but it's definitely still a concern. Lynn asked in the chat, how has COVID had an effect on hearing loss?
Well, that's interesting too, because there's been several audiologists that have been doing research, and what you see, and I think they've been reporting as brain fog, is actually a disruption in the neural transmission of the signal. So again, it could be an auditory processing problem from COVID, and that didn't go away. And again, the only way you're going to know is to have it checked.
Thanks. Kelly asks in the chat, how can my mother be a better advocate for herself at the doctor when communicating her hearing loss? I feel like my brother and I are going to have to start going to appointments with her to appointments, and it is very frustrating for her.
Well, that would be. I'm trying to think of physicians, for the most part, do not understand what's going on with hearing. Because one-on-one, face-to-face in a quiet exam room, the person with a hearing problem can get by. But one thing you could do is contact the physician's office and just say, when you're talking to my mother, do you mind pulling up a captioning app that will spell out, like you had during my presentation, there was captions at the bottom. So if you missed a word, you could read it. And so he could do that on his phone and just let her read what he's saying if she doesn't have, or they could put the captions on her phone. and teach her how to open that when she goes in, so that she's understanding what's happening.
Are there certain caption apps that, oh, Kelly says, thank you. Are there certain caption apps that you would recommend, or is it just people take a look at the App Store and have it and see what works for them best?
I did, and somebody asked me that recently, and I still haven't found. I have a list of some of the best apps.
We can always send that out later if you have if you have that around. We can always send that out when we send out the follow up for this. So.
Okay, but you can do a Google search for captioning, and maybe try it out yourself to see which one seems to work best, that you could recommend.
Gotcha. And does it seem like most of them have the ability to enlarge the text and all that for folks who also have some visual impairments?
Yes, yes.
Okay. I was curious, and I don't know if people are welcome to unmute if they want to ask a question as well. But I had a question. I think, where do people, if people are looking for where to go to access a hearing screening or a vestibular screening in their community, what are some good places to start?
For a hearing screening, I would just go to our website, so you don't even have to leave unless you don't have a computer or you're not used to it. So just to know yes or no, go to our website and do the quick screening. If it's yes, if it's yes, then we do have some tabs that where you can search for an audiologist. But what I've learned is they're not comprehensive. So actually just Googling again, audiology or audiologist near me should bring up those offices that are close by.
I'm going to go ahead and put the hearing screening back in the chat. And that's something I think, very easy, low cost thing that different congregations can do. They can maybe set up a time after a church service and have a couple laptops up in various places, and maybe just allow the people in the congregation to do a quick hearing screening. Just
as long as the location is quiet. So if you have 20 people talking to each other waiting in line, that might be difficult.
No, but sure. Quiet office, and then y'all could offer that there. Great. Does anyone else have any questions?
May we have a copy of this presentation?
Certainly.
Absolutely.
Yeah. I'll be glad to send it to you.
And I have another question. I don't know. I have this problem. I don't know if you see this in your practice, the speaker phones. When I talk to people on the phone and they're on a speaker phone, I have a problem. It's something about the hearing is different.
Yeah, it probably does have a different sound to it. And depending on what your hearing levels are, it could impact how you're understanding it. So have you had your hearing checked before?
Practice that other people have that problem, or maybe it's just me, but I usually can pick up on it because the voice is different and I can't hear it as well.
To answer her question, I have that problem. This is Madeline Avant. I do wear hearing aids, and if I have it where it can, if I'm talking to someone, they ask me what's that background noise, and so when I turn my hearing aids off, they don't hear the background noise, but I don't hear them as well. So and my brother, when I'm talking with him, so I know exactly what you're talking about. I have it two ways.
Well, if you have hearing aids, many of the hearing aids now have Bluetooth connections. So if you have a cell phone, you can connect your hearing aids to directly go into your phone will directly go into the hearing aids.
And I'm not trying to get a private class, but that's exactly when I turn the Bluetooth off, that's when they can hear me better, because they can hear, for whatever reason, they can hear the background noise. So I do have it on Bluetooth, but I have to turn it off.
I would go back to your audiologist and get it checked. There might be something wrong with it, because it should cut off your microphone. so that you're only connected to the phone.
Okay, thank you for that private class, and thank you for that question so I could get that private class.
Certainly, yes.
Hello, this is Francine McLaurin. How you all doing? I just wanted to share my family. I wearing hearing aids now, but my family for years have been saying something is wrong with your hearing. You can't hear, and I'm thinking that's old people. I'm not old. So I just ignored it for years. And finally, my husband was coming in through the garage. He said, the TV is so loud. Why can't you hear it? So I had been going to, like I said, screenings, but I went to an audiologist and they said I had not severe, but profound hearing loss, which again, not me, it's that older person. And that I'm not that older person because I was associating it with old people. But when I got my hearing aid and was adjusted, I started crying. What I had been missing all these years, just hearing the birds and the trees and things I had just forgotten about. I said, this is what I've been missing. So when I saw that PHW was offering this, I said, I've got to log on to this Zoom webinar, and I want to share this information with my congregation and with the community because it's so important. Thank you, thank you, thank you. My daughter walked through as I was listening.
Whoops, your mic went off.
That's it. That's it. Thank you.
Thank you, Francine. No, I so appreciate it. And we really hope that this would be helpful. And I think there is a lot of that kind of it maybe a little internalized ageism that we get, that we're like, there's such a stigma around, getting older and things that are associated with age. And I think sometimes that hinders us, getting help with different things as they come up, because we don't want to associate that with who we are. But I think the more comfortable we can become with the process of getting older, make that easier and more acceptable to go and get help with that. I'm so glad that you did. And I'm glad that you're here to spread the word to make sure other people don't hesitate to go and get that checked, for sure. Thanks, Francine.
And it's not just an old person's
No, for sure.
I'm thinking of this one little boy in the Wake County schools that was getting ready to be placed trainably mentally retarded. And they referred him to me. They had not checked his hearing, and he had a severe hearing loss. So I said, go back and retest him and use this called the LIDAR, which is a different test. And he had normal intelligence, but they were getting ready to put him into a track of trainably mentally retarded. He had no ability to be educated, etc. So yeah, it happens with kids too in schools. Not as often as with older people, but still.
That's frustrating. Especially now you think that we would be better at that. I think Susan's raising her hand.
Yes, I have a comment and a question. I was a primary school teacher before I retired, and I did have a child many years ago who was a kindergartner who I realized had lost his hearing in at least one ear, and it actually was correct. And so we had to make sure the child was seated, his good ear was seated close to me, and the way we did it was he would look at my ring finger, and he knew that's the side he was supposed to be near. But as a reading teacher, when I was about 50 years old, I had a hard time listening to the children read to me. I couldn't hear them. I kept saying, speak up. And so the audiologists in Wake County schools found that I had a hearing loss. I have not gotten hearing aids, and I need to. Money is the big issue. Even though I have the money, I just don't want to spend it. But people are pushing me to do that. But my question is this a separate issue. Auditory processing. When I get a phone call and somebody that I don't know and is telling me something kind of out of the blue, I don't have context for their speech, I have to ask them to slow down so that my brain can catch up and make sense of what they're saying. And then I can make sense. Is that separate than just a hearing issue?
Well, the fact that you can't hear well, it's hard to know if it's auditory processing or the hearing loss, because with the hearing loss, when you think of that Flintstones video, some of the speech sounds are just missing. They just go away. So what you're trying to do is fill in the blanks as somebody's talking to figure out what they're saying. When in fact, if you could hear, then you'd have a better chance, or the audiologist can do some auditory processing testing at a level that you can hear it to know if that is part of the formulation of what's going on with you. So, but yeah, just having a hearing loss can look like an auditory processing problem because you don't hear all the sounds.
Right. I know I have an issue with fricatives, is what they told me. Because I've had my tested a number of times over the years, and I just really need to go ahead and do it at this point. And my understanding is that once you have hearing aids, it takes a few months for your brain to adapt to them.
Yes, it takes 6 to 8 weeks to get adjusted. So, you know, don't think when you first put the hearing aids in, it's going to be all nice. I mean, you're hearing sounds you haven't heard in a while, and your brain will make the adjustment. But you have to wear it every day, put it on in the morning and keep it on till you go to bed at night. And over the course of 6 to 8 weeks, it just kind of fills in all the blanks and you hear it better and process better. So yes, exactly.
Okay. This has been motivating. I signed up for this to get that education because I knew I needed it. And this is motivating for me to make that appointment.
Bravo. That's great.
Oh, I love that. Thank you, Susan. Thank you. That's a great affirmation that this was the right timing for this program. So, like, give us an update at some point, Susan. Let us know how it goes once you do get there. I'd love to hear back from you. We have time for a couple more questions if anyone else has some. If not, do you have any other recommendations of ways that congregations can help support folks around this? I mean, being here obviously on this program is helpful, but around hearing impairment, vestibular issues, and those sorts of things to make things more accommodating even?
Well, I think the biggest thing that I see from my perspective is that physicians need to be educated because a lot of them don't, you know, again, one-on-one, face-to-face in a quiet exam room, they don't see it. And they'll say, oh, your hearing is normal for your age, you know, and that's kind of what's happening in nursing homes. You know, they're guessing. Oh, I think I've had people tell me I can tell when they have a hearing problem. And I'm thinking, I worked for 40 years testing hearing. I could never tell until I put them in the booth what the problem was. So how could you know that without any training? So yeah, you just have to have it vetted.
Sure. So then maybe, you know, if there's members of your congregation that might be having a problem with hearing loss and they want someone maybe to go along as maybe an advocate for them on a doctor's visit, maybe that might be helpful. Does that seem?
Well, that might be helpful to say, for them to say, can you give her a referral to get her hearing checked? We want to have that checked. Or the person themselves can ask that. But again, anosognosia, the person themselves sometimes doesn't realize how bad it is. Everybody else does, but they don't. So,
gotcha. Susan, you have another comment?
Yeah, I have a comment about that. I moved back to North Carolina right before the pandemic. I was up in Maryland for about 10 years taking care of my parents. And while I was there, I joined a United Church of Christ congregation. And the interesting thing is that I moved back right as the pandemic was starting, when churches were beginning to record their services because we didn't have in-person worship. And the church that I'm a part of in Maryland still does Zoom worship. And I love the people there, but I can hear and I can participate with Zoom worship rather at the church here in Wilson that I might possibly be interested in. It's not open and affirming, and I wish it were. It should be, but I went to some of they had some concerts over the summer. And when I went, I could not hear the introduction to some of the music. The space in sanctuaries is just so open and huge. But when I went home, they recorded them, and I listened to them, went back and listened to them. These were on YouTube, live recordings. I could hear what I missed. So I don't know with these live recordings, but Zoom has really helped me. A lot of congregations can't do Zoom. I'm a part of a small congregation in Maryland, but we have joys and concerns, and I can participate. People who are at home can actually be readers of scripture and that kind of thing and still participate. So I've enjoyed the technology because it has helped me to participate in being in a quiet environment at home. I don't like right now, I'm not having a hearing issue. So.
Thank you, Susan. Yeah, I feel like there were a lot of ways that having to move things around a bit with COVID has helped create greater accessibility for folks who were sometimes missing out, given the architecture and the acoustics of sanctuaries and such. So that's a good point. One more question we'll take from Kelly. Kelly had her hand raised.
Yeah, it was really just a comment as a preacher. I think it might be good to offer some education on even like how to use a microphone properly and not assuming, well, I have a big voice, I don't need a microphone. I see that a lot. But maybe it's because my mother has significant hearing loss. I'm more sensitive to it, but I work in a retirement facility, so that's my congregation. But I think there may be something out there for just ministers in general and understanding microphones have to be held really close to your mouth, and you need to make sure the monitors are working and your choir behind you has monitors, all of those things. And that requires an investment on churches too.
There's also a loop system that you can install in any sort of large room. And so people that wear hearing aids that have T-coils can switch, and the mic signal comes directly into their hearing aids. Or they can wear a device that converts it to Bluetooth. So yes, those are wonderful options for churches to install those.
Yes, especially if the pastor uses the microphone well.
Yeah.
That is such an excellent point. And, I think some of y'all, if you've been following along for a bit, we have created this healthy aging inclusion plan that's up on our website, and I can put a link to it as well. And among those things were some suggestions around like accessibility for visual impairments and hearing in terms of like hearing assistant devices and whatnot. But yeah, it definitely could be helpful to add, use of mics and proper use of mics to that, just those simple options. And I think, yeah, Stephanie put the inclusion plan link in the chat. Thanks, Stephanie. I appreciate that, Kelly. That's so important. Hold on, there's one more thing in the chat. Someone was asking about just basically like a private message here. Financial accessibility, even for earbuds. They were looking at Bluetooth. Are there maybe some wired options that might help for those for whom Bluetooth compatible earbuds would not be in the budget?
Not sure if that relates to hearing aids or
yeah, I think this was more the options for listening to or hearing better in the church service. To the person who asked that, I can do a little research and try to get back to you. If you want to give me your email address in the chat, and I will follow up with you on that question, if that works. Yeah, Bluetooth is just a way of connecting wirelessly. All right. In the interest of time, I want to go ahead and wrap up. If you have questions around healthy aging work within the Council of Churches, feel free to reach out to me at krista@ncchurches.org. Again, you can find Kathy's organization, the Audiology Project, on their website. You can visit our website, healthandwholeness.org, and follow us on Facebook and YouTube. And we will send out a copy of this recording and all the related any slides that we have and links and those sorts of things out to everyone. And again, if you had a question that you wanted to get an answer for, you can either drop your email in the chat or you're welcome to email me. But I will try to, I'm going to actually jot down the person who chatted me and I'll try to reach out to them directly. All right. Thank you so much, Kathy.
Well, thank you for the opportunity this morning. I appreciate
This has
it.
been very instructive, and I look forward to hopefully working with you again. I know you have other things that you offered up, and we would love to hear from you again. I think this is really informative. And on that note, I hope that everyone has a wonderful rest of your Monday. Be well, stay safe, and take care.